The Border Management Authority says it has put measures in place at all ports of entry to combat the spread of Mpox.
The Department of Health has confirmed that 3 more positive cases have been confirmed and 1 death.
This brings the total number of cases to 16 since the outbreak last month.
8 cases are in KwaZulu-Natal, 7 in Gauteng and 1 in the Western Cape.
The number of Mpox-related deaths has increased to 3.
The BMA is now implementing screening processes for travellers at all ports of entry.
Commissioner at the authority, Michael Masiapato, has announced that travellers will be subjected to thermal screening to check their temperature. The authority continues to encourage travellers suspecting any symptoms to seek immediate medical care, especially those with a travel history to areas with Mpox.
Now joining us to expand on the plan is Murdock Ramathuba, Assistant Commissioner at the Border Management Authority. Good evening, Mr. Ramathuba. Thank you very much for joining us on The Full View. So the Border Management Authority has announced an Mpox outbreak preparedness plan. Just talk us through this plan.
Thank you very much and good evening to you and the listeners. The plan is largely looking at strengthening the responses that we put in place in the ports of entry. I suppose you already know that one of our responsibilities is to prevent the importation of diseases or any events of international concern in the ports of entry. In this case, we have strengthened our vigilance in terms of the screening that we're doing there, so that using the thermal scanners that we have in the ports of entry to isolate those people with elevated temperature so that we can observe them, and if need be, they can be transferred to the nearest health facilities, which we have a very good cooperation with the provinces, the 9 provinces, and the ambulance services to assist in taking our patients to the health facilities.
So if we just had to be a bit more granular, so if one has a higher than normal temperature, you would then put them aside. There would then be, what happens then? There would be a process to examine them. What happens immediately at that port of entry?
Depending on where it is. If it is in our larger ports like your OR Tambo, your Lanseria, you will have our nursing staff in the clinic within those ports to do further examination, and in remote ports like your Bait Bridge and other land ports of entry, that's where our port health officials will assist in just observing the symptoms that could be there. You know, the lesions that you're supposed to see on the skin and related matters, and if they see anything, that's where, with the collaboration that we have with the ambulance services or EMS, we will request them to be evacuated to the health facilities nearby. But so far, there is no case that we're able to isolate, nor any person known to have traveled into the country through our ports of entry.
This sounds like a very good initiative. It's a good plan, but I almost foresee some people feeling as though they are being victimized at some point. There could be those when we speak about the lesions on the skin and things like that. So how are you looking to address that? Because if somebody is pulled to the side because they do display some sort of symptoms, particularly those on the skin, people can be very sensitive, a bit self-conscious about such things where it might be unrelated to Mpox. How are you planning to address some of those?
That's very true. That's why issues of customer relations is very, very key in terms of them having to engage with people in a way that doesn't seem to be discriminating them. That's why our first line of assessment will be the thermal scanners that will have identified that a person is in an elevated temperature, whether lesions or no lesions. Elevated temperatures, they need to be pulled aside, be observed further. And over and above that, in airports and seaports, we then have that situation where the captain of that ship or that flight.
Yes.
There is something that we call general declaration that will declare, where they will declare that with the people that they were transporting, there were no any signs or symptoms of any illness that they could have occurred while they were on board. And this is not only looking at Mpox, for any illnesses are picked up in those cases. When the pilot reports, by the time that flight lands, the port health officials are conscientized, they're aware of that, and then EMS is conscientized to be on standby should there be a need for evacuation.
Now, we understand that the MBA port health officials will, among others, conduct their own general and non-invasive observation of travellers under investigation. But for those who might not be familiar with this term in particular, what do we mean when we talk about non-invasive observation?
Non-invasive is when you do not fiddle with a person's tissues. When you go to a clinic and you have an injection of an antibiotic, then there is a needle that is inserted into your skin. So with this one, it's observation on the outside. Exactly what we were talking about earlier when we talk about the observation of symptoms. So you don't need to touch a person or to fiddle with their person as such.
We also understand that the health officials will also focus on health education awareness. What form will this health education take?
Firstly, it's with regard to the pamphlets that we are putting together, in addition to what the Department of Health has developed in provinces and also in the National Department of Health, just to communicate to our travelers, indicating what are the symptoms of this illness, and when you've got any of the symptoms, what do you do? Look for the health facilities so that you can get assistance. It's generally about that, to protect themselves and also to protect the rest of the population, so that we don't have occurrence and spread of this communicable disease.